How to treat bulging discs. The spine consists of vertebrae or bones that are stacked upon another, and in between every set of vertebrae there is something called an intervertebral disc or a spinal disc, and it sits in between every pair of vertebrae, and the discs have very specific types of functions that it provides for the spine. Now, the main parts of the disc is something that we call a soft gel-like interior called the nucleus, and then a tough outer membrane or outer area called the annulus. Discs are made of water, collagen fibers, and proteoglycans. The main functions of discs are to provide spinal flexibility. And when your discs are really healthy and really hydrated, your spine has more flexibility inherently as they will become deteriorated, degenerated, and bulging. So that's why kids, because they have a lot of vascular supply to their discs, they normally have a lot of spinal flexibility. Discs also provide the spine with structure because they are actually taking up some space in between every single vertebra, and therefore they provide structure and spacing for a lot of the nerves and tissues. Discs also provide cushioning in between adjacent vertebra, so we don't have necessary friction between two bones because they're not touching each other, and they also act as shock absorbers. But really, most of the thing when we look at discs, and the main function is flexibility and movement, because if all these vertebrae were united together without discs, your spine will be one solid bone, and when they're one solid bone, you will not be able to move throughout your torso and spine. So the main function that discs provide is spinal movement and spinal flexibility. So one of the key signs of your spine discs becoming unhealthy is normally spinal stiffness. If you have stiffness, that could be a sign of disc problems and disc issues. Now, when we look at bulging discs, we know a bulging disc occurs when the inner nucleus bulges the annulus towards the outside. It can be to the left or to the right or towards the back, some very rarely towards the front, but normally it's left, right, or back. And then when it bulges out around its perimeter, this disc now starts taking up some of the space that I mentioned for some of the spinal canal and nerves. And when it starts taking up space, these bulging discs can start to press on some of these tissues, start leading to radicular pain and neurological pain, which could be more than just spinal stiffness. Also, as these discs bulge, they also become stiffer, which can lead not only to stiffness, but it can also cause pain, because when the joints don't move properly, it can also lead to more pain. Now, the main thing that leads to disc bulging is something that we call spinal alignment. Spinal alignment is the number one thing that leads to a bulging disc. And I like to explain it like an ice cream sandwich. Imagine if you had two hard cookies of an ice cream sandwich, you had ice cream in the center. Well, the cookies are the vertebra, the ice cream is the disc. If you squeeze the ice cream sandwich on one side, you're going to get bulging out on the other side. Now, nothing is wrong with the disc. It's the alignment of the two hard cookies, or the hard bones in this case, causing the disc to bulge. So once we have spinal misalignment, that starts to lead a cycle of problems start to occur. Think of an unaligned car. If a car is not aligned properly, one tire, a spinal disc, will start to deteriorate and degenerate now faster than the other because there's abnormal weight bearing. And this abnormal weight bearing leads to spinal degeneration. Now, the spinal degeneration can also be exemplified or made worse as a result of other cumulative effects like lifestyle choices like obesity, sedentary lifestyle, poor posture, alcohol consumption, smoking, repetitive lifting, bad ergonomics. So when you add a misalignment and spinal degeneration and abnormal lifestyle factors, this can lead to something they call degenerative disc disease. But understand, the initiation of the degenerated disc typically was associated with an alignment problem. And this alignment problem leads to that bulging, which leads to all these other things. Also, as the alignment isn't proper, like I mentioned, the spine doesn't move as well. And as it doesn't move as well, it becomes something called desiccated, or there's disc desiccation. Disc desiccation is where discs start to lose the hydration that they have, and they start becoming dehydrated and brittle and stiff. And as the discs become hard and brittle and stiff, they're more likely to cause more herniations, but they limit motion, and again, it tends to cycle each other, because the stiffer it becomes, the more the alignment problem happens, and these things kind of propel each other unless you intervene. And the first step in intervening in terms of treating a disc is to determine the underlying cause. Where is it and what's happening? Now, a lot of times MRIs are taken to say, okay, this disc is degenerated, to say, okay, you have a disc problem at L5 or L4 or whatever that would be. But MRIs are just telling us what we already know, that you have a bad disc at this area. A lot of times you need to look at the overall spinal health and alignment to determine what's causing this asymmetrical weight bearing on the disc that's leading to this degeneration phase. So understanding and determining what's causing it. Also, lifestyle modifications. We know that there are lifestyles that can cause the disc to degenerate quicker. Well, sometimes eliminating some of these lifestyle things that we mentioned earlier could help alleviate some symptoms. But the majority of cases, if there's already a disc issue, there's alignment issues that won't resolve just on lifestyle. That typically requires a combination of very specific physical therapy, chiropractic care, and other types of conservative managements to help manage the alignment to get the spine realigned to help the disc regenerate and heal. Now, typically, surgical approaches resolve just either cutting part of the disc out, that's bulging, which weakens the disc in entirety and makes it thinner, which can lead to more compression, or it can involve removing the entire disc altogether and fusing the vertebra. That's called a discectomy. And when they fuse those vertebra, they eliminate the need of that disc because they're fusing. But once they fuse those two bones, it puts more stress on the bones above and below that fusion, which can lead to more herniated and degenerated and bulging discs. So the best way is to realign the spine and to deal with a bulging disc in a conservative manner typically leads to the best long-term outcome. Now, we know leading a spine healthy lifestyle is very important for disc health and hydration, but if there is an alignment issue that occurred from some kind of a trauma or some type of injury, we know lifestyle guidance alone isn't the factor that's going to make the spine get into a straighter position. You need something very specific that's going to restore that normal alignment. And here at the Scoliosis Reduction Center, we actually perform that type of treatment because we realign scoliosis spines. We can also realign spines that have bulging discs associated with them because in almost every scoliosis case, we have associated bulging discs. Thanks for watching. I hope you found this information helpful. If you'd like to hear about other topics and information on scoliosis, type in the comments below and let us know. And finally, subscribe and hit the bell icon to be notified of when we publish content. Thanks.